So we have the outcome of patients with myelodysplastic syndrome is very heterogeneous. It means that it's really hard to find two patients that they have the same outcome. Now, our current models that we use in clinical practice use clinical variables to provide outcomes for patients, but we typically have shown that the outcome that we predict for a specific patient, there's significant difference between what we're predicting with the model and the actual survival of the patient. So the question came to us is, can we build a model that can risk stratify patient and provide personalized prediction that is specific for the given patient and provide information for them as well as the treating physician? So what we have done, we took clinical and mutational data from a cohort of patients treated at Cleveland Clinic and from Munich Leukemia Laboratory in Germany. This is about 1,417 patients. And we use a machine learning algorithm called random survival for this. So we enter all this clinical data into the algorithm. And then after that, everybody talk about machine learning as a black box. So we try to extract features from the algorithm. In other words, try to ask the algorithms what are the important variables that impacted the outcome. And this is very important because for two reasons. Number one, we can dissect those variables and be sure that the algorithm are picking the right clinical variables. And also we can learn from the algorithm if there is any new variables that we didn't discover in using traditional statistical method. So after we train our model, in order for us to use it in the clinic, we have built a web application where the user, in this case is a physician, can input the clinical data and the mutational data, and the output will be a survival curve that is specific for a patient, as well as survival probability at different time points. We then took this model and validated a completely independent cohort from patients treated at Moffitt Cancer Center. So now we're really refining the website to be available for physicians where they can enter this information and hopefully can aid them in their decision. So the concept of this project was, can we develop personalized prediction? Now, we always talk about personalized medicine or giving a personalized treatment for a patient, but we really don't spend too much time talking about personalized diagnosis, personalized prediction. So I think the concept of, can we identify risk that is specific for our patients? I think it's very important for our patients because our patients ask us for that. And also very important for us as treating physicians because we don't want to overtreat and undertreat some of the patients by defining their risk wrong.